The two main types of diabetes are type 1 diabetes and type 2 diabetes. Type 1 diabetes is the one that usually comes on during the ages of around 12 to 16. Then there's another peak in young adulthood, but can come on at any age. Now, type 1 diabetes comes on relatively quickly, and the patient will have symptoms such as weight loss, feeling thirsty, drinking lots, maybe having thrush, blurred vision, and other infections as well. Type 1 diabetes means that your pancreas is no longer making the right amount of insulin for you, so you need to go on to insulin. Without insulin, you would go on to become very ill, develop diabetic ketoacidosis, and that can be life-threatening. So, quite simply, if you've been diagnosed as having diabetes and you go on to insulin within 6 months of your diagnosis, the chances are that you've got type 1 diabetes. Now, out of every 10 patients, only one would actually have type 1 diabetes. It's probably nearer 1 in 20. So it's somewhere in between 1 in 10 to 1 in 20, dependent on which community you're looking at. Type 2 diabetes is therefore far more common, and it's associated with being overweight, reduced physical activity as well, and there's also a very strong family history. Now, this is a condition not of lack of insulin, but of what we call insulin resistance or insulin deficit. So the amount of insulin that your body's making is not enough for you because of the overweightness, maybe because of the reduced physical activity as well, because our muscles are very good at picking up glucose from the bloodstream. So one way that the healthcare professionals will work out how good your diabetes control has been is to look at the hemoglobin A1C test. This test measures the amount of glucose sticking to your blood over the last 8 weeks. And there'll be a value that we usually aim for. It should definitely be less than 58 in the vast majority of our patients, and the units are millimoles per mole. However, in an older person, we might aim for a value of less than 65, for example. But in a younger person, we might want to make that value as normal as possible and as close to the person without diabetes as possible. So it's dependent on the patient in front of us, but usually the value that we aim for is 58 millimoles per mole or under. So when it comes to glucose levels for people with diabetes, we usually aim in between about a 4 and a 7 on waking. But it depends. If you have other conditions, maybe if you're older, living alone, we might have to accept a 5 to 10 as being what we aim for. But generally, especially for the younger person without significant other conditions like kidney disease or heart disease or heart failure, we want to keep that glucose level as tight as possible, especially on waking and before each meal. So I think it's reasonable to aim for a glucose level of 4 to 8 before each meal and lasting at night as well. So when a person with diabetes is unwell, they have to think about the two main reasons. Clearly, you should always think about other reasons, such as an infection brewing, or is it heart disease? Is it fluid building up on the lungs? There will always be other reasons why the person's unwell. But two big ones that they should look out for is low sugar level, which is hypos or hypoglycemia, or high glucose levels, which is hypers or hyperglycemia. With hypos, the person feels frightened, feels sweaty, their heart rate will pick up, and they can also get confusion, and they'll also feel hungry. So then they'll have food-seeking behavior, hopefully towards those glucose tablets to get rid of their low sugar level. Hyperglycemia is actually more difficult to recognize because people will have non-specific symptoms such as feeling tired, having a little bit of abdominal pain, feeling sick, or maybe actually vomiting as well. It's interesting that during my career, we've gone from the 1970s where we could not check blood glucose and we just had to check the glucose in somebody's urine by heating it up and putting a tablet in. But now we have amazing ways of testing glucose levels. The finger prick will get a result within 3 to 5 seconds with most of the modern machines that we use. And they're also very good for monitoring safety signals like the ketones as well. But we also now have continuous glucose monitoring and flash monitoring. So we can put a device under our skin and just put a device over it or our smartphone, and it will actually tell the person with diabetes what their glucose level is and also the trend. Is the glucose level trending upwards and therefore not so good, or is it trending downwards quickly and also not so good? So it helps the patient manage their diabetes, because you may see your practice nurse, you may see your general practitioner, and they may be able to sort out your blood pressure on that one visit. But then maybe they'll say, can you please come back and see me again, or the practice nurse again, and we'll examine your feet. And the urine must be tested for the amount of protein that you might be losing. Because if you're losing a lot of protein in the urine, then that means early kidney disease, which can be sorted out with the right drugs to control the blood pressure and some of the new agents that we know reduce the chances of the kidney disease progressing. And then you must have a drug review to make sure that all the drugs that you're taking are taken by you safely, without significant side effects, and continuing to be a benefit for you as well. There are many resources out there for people with diabetes. Diabetes UK just becomes better and better as a website. There are many information prescriptions on there which are particularly valuable, and a lot of healthcare professionals are using them. And you also need to look at the videos in the learning zone, for example, where some of this education that I'm providing will be embedded in, as it were. But there'll be lots of other resources out there. But I think one of the best resources that we don't think about is our clinical pharmacists. Our pharmacists in the community have almost the same amount of university education as the medical doctors. They're a font of knowledge, and many of the community pharmacists now specialize in diabetes. So I think they're a great opportunity to talk about particularly the drugs, maybe get your blood pressure checked, and you should also have a good relationship with your optician, as it were. Although you'll have diabetic retinal screening, the opticians will be able to give you good advice on eye health generally as well.